risk for sleep apnea? And if so, what are some symptoms I may have?
Many factors are taken into account to identify if you're at risk for sleep apnea. Your provider may ask you to fill out a stop-bang questionnaire or an Epworth sleepiness score to determine if you're at risk. Symptoms of sleep apnea include feeling tired during the day, not feeling refreshed after you wake up in the morning, needing to take naps during the day, waking up frequently at night. Family members may tell you that you snore at night or you stop breathing. If sleep apnea is suspected, it's important to refrain from driving until you've been properly tested and treated. Untreated sleep apnea puts stress on your heart and it puts you more at risk for having things like stroke, irregular heart rhythm, and even death.
What is a sleep study?
There are different types of sleep tests to determine if you have sleep apnea. For patients with mild to moderate cases, a home sleep test may be used to help determine if you have sleep apnea. An HST device usually involves wearing a finger probe to sense oxygen level and heart rate, a small flexible cannula placed in the nose and mouth used to sense breaths, and a recorder to store data. For suspected moderate to severe cases of apnea, or to rule out seizure activity, an in-lab sleep test called a polysomnography, or PSG, is preferred. A PSG monitors oxygen, pulse, and apneas like an HST, but in addition, measures continuous heart rhythm, limb movement if you're kicking a lot in your sleep, brain waves to monitor what stage sleep you're in, and can identify if the apneas are obstructive, from airway collapse, or central, which occur from improper brain signaling.
How was I diagnosed with sleep apnea?
Several numbers from your sleep test will be used to determine if you have sleep apnea and how severe it is. Your apnea-hypopnea index, or AHI, is how many times you stop breathing per hour. An AHI over 5 is considered positive for sleep apnea and treatment is indicated. Other measurements such as respiratory-related arousals and the respiratory disturbance index are used to determine the severity of your sleep apnea.
What are the treatment options for sleep apnea?
Maintaining good sleep hygiene, weight reduction, and healthy diet are indicated for all patients who have sleep apnea. For mild to moderate sleep apnea, oral devices that help keep the airway open or having the UPPP procedure may be sufficient. For moderate to severe cases of sleep apnea, positive airway pressure, or PAP therapy, is indicated, and a titration study is recommended. A titration study is an in-lab experience where a certified sleep tech fits you for a mask and, while monitoring your respiratory status, initiates continuous positive airway pressure, or CPAP. Pressure is increased slowly until your apneas are resolved. If your apneas are not controlled with CPAP pressure, BiPAP or other advanced modes of therapy are indicated.
How do I know if my sleep apnea is controlled?
After you receive your PAP device, it's important to keep in close contact with your healthcare provider to ensure that your device is working well. Your sleep quality will improve and your snoring and daytime sleepiness will resolve. Your PAP machine will record how many hours of sleep you're getting, if there is a leak problem with your mask, and most importantly, your AHI score. Remember, our goal is less than 5. Keep in mind that PAP therapy is very individualized. Your sleep team will work with you to find the right mask, pressures, and humidity level for you.
Be sure to ask your doctor if you are at risk for sleep apnea and what symptoms you should look out for. Untreated sleep apnea is dangerous and puts stress on your heart.
If you are at risk for sleep apnea, ask your doctor what type of sleep study is best for you.
After being diagnosed with sleep apnea, ask your doctor how severe your sleep apnea is and know how many times you stopped breathing per hour during your sleep study.
Discuss which treatment options are indicated for your sleep apnea. Remember, good sleep hygiene and weight loss are indicated for all patients with sleep apnea.
If you're on PAP therapy, keep your follow-up appointments with your physician to monitor how well the treatment is working for you. Ask for help with any issues you're having with your mask or machine. And remember, PAP therapy is very individualized. Don't stop using your machine without speaking with your healthcare provider.